Today we have a case of an ulcer submet 2 on the left foot that's below the second metatarsal head, and our patient is a hiker. The ulcer has been present for some time. We haven't seen him in a while. He's been followed by a podiatrist in California, and currently we're going to be obtaining a wound culture. He has been on Keflex, not Keflex, it was Augmentin, 3 days, and that was $875. And so far has not had any improvement after 3 days. So we're probably going to be looking to put him on a tetracycline that is a new tetracycline that does better for bugs that have resistance, picks up strep. This could be a strep infection, that's a common one. And it also does well with methicillin resistant Staph aureus. So I'm going to just take some video of the wound of the cellulitis. The patient is currently not febrile. Here is the wound itself, and what we're going to do now is obtain a wound culture. With the wound culture, we have to make sure that we get the wound culture deep enough or it's not going to be relevant. So we're going to obtain the wound culture, and the probe itself of the swab can give us an indicator, and this does probe very deep, and I feel like it's right at the metatarsal head, so that is does have some predictive value that we could have potentially bone involvement. So this is definitely a case that we're going to have to manage very closely. We've already obtained some x-rays that we'll review in a moment. The way that we can ascertain wound depth, I'm using a swab, and we can see that the white part of the swab is almost fully in. It's maybe a millimeter short of the white neck of the swab. So then all we do now is we put that up against our measuring tape, and then we'll get a measure. So if we get the measuring tape up, we are officially at just over, so we're going to call that about 1.2 on the depth, because it didn't go quite to the end of the neck of the swab. So the x-rays look pretty innocuous. Here is the second metatarsal head right here, and we do not see any apparent damage, but it potentially could still be infected. So we're going to get some blood work, CBC, BUN with creat, a SED rate, which is a marker for inflammation, possible bone infection, and also a C-reactive protein, which is another marker that could potentially detect bone infection. To get 2 views, and on this view, there's nothing impressive in terms of the bone, just a little bit of soft tissue swelling in the area of where the ulceration is.